Of course, if there's casting, splinting, or something involved, our athletic trainers are generally doing that unless they're busy, and then I'm doing that. We have a guy that does our durable medical equipment. So someone needs a brace or someone needs crutches or a walker or something like that. They'll go in the room and show them how to use it, get them using it, and then get them out the door. So yeah, it really is a team effort for sure. So yeah.
Dealing with joints as much as you do, I know as a health coach, I see a lot of issues regarding both chronic and acute inflammation. How much does that play into what you see with a lot of folks that maybe come in to see you that have these severe joint issues? How much does the inflammation factors play into this?
Oh, huge. I don't think people realize, even like osteoarthritis is a very inflammatory condition. So when people are getting this osteoarthritis pain and I explain that to them and they're like, well, I just started having this pain like a couple days ago. And I've probably always had arthritis. I didn't form that a couple days ago. So it's a big discussion that this is more of an inflammatory thing and you're having an inflammatory response to the fact that you have arthritis in your knee. But then also like acute injuries and stuff, that's major. Like whenever people have like big meniscus tears or they have ACL tears or even like their collateral ligament tears, your knees tend to just balloon up. You can kind of almost spot it from them walking in. Something is going on internally, and that is an inflammatory response in itself. So kind of explaining that to the patient that, okay, this is why you have so much fluid in your knee, is because your body's trying to heal this. It's trying to wash out the problem. So inadvertently, you're just pocketing all this fluid. That is a problem for people because that will limit your range of motion. That in itself is super painful, especially if, maybe the fluid is more blood related. That is super, super painful to a joint. So yeah, the inflammatory thing is huge. And I have patients all the time that ask me about recommendations for, anti-inflammatory methods that are not like medication, not like taking NSAIDs. We'll talk about turmeric. Turmeric is a good kind of a natural anti-inflammatory. Put in your food, take it as a pill. There's lots of things you can do with that. And just icing in general is really good. Anyone that has an inflammatory problem should be icing rather than heat. I get that question all the time. So, there's a bunch. And then when we just can't kick it with some of these things, then, NSAIDs are certainly an option if it's good for the patient. But that's usually kind of our first line and kind of explaining to them why you're having this inflammatory thing and why we treat it with an anti-inflammatory is pretty helpful to them.
I believe that our broadcast might have got started a little bit late on Facebook. So again, if we did, I apologize to everybody. But again, we've got Sam Belvin with us, and of course Sherri. We already mentioned again that you guys are related with as a niece and aunt, and in a relationship, and that's really cool. But as we move forward, talking a little bit more about this whole issue in regards to how you treat your patients, what really got you started? What drew you to this field, Sam? Why did this? What's your calling here?
Well, honestly, my biggest inspiration sitting, I guess she's for me. She's
raise the roof. Let's raise the roof, right?
But just seeing like her job just seems so cool. I knew I wanted to do something in the health field, have that like just passion to kind of make people better. That sounds so cliche, and people say, "Oh, I just want to go into medicine because I want to help people." It's so silly, but it's so true. And it's like deep rooted. Like, I don't know if anyone's ever taken like an Enneagram test, but I always end up being like the helper, the healer. So it's just kind of like in my core to just like see a problem and try to help people fix it and kind of do it as a team effort. Like, I love that. I just love that. So in school, it was mostly just about finding like what path I wanted to take. Initially thought maybe going to medical school was where I wanted to go, but I kind of had a little run-in with someone that taught me about PAs and what they do. And so I was like, oh, that sounds pretty interesting. I like that. I like that a lot. And so I did my own research. Unfortunately, so I went to Mizzou, and they didn't have a ton of resources for PAs at the time. So the guy that I had met through like a shadowing, almost like a volunteer thing we were doing at University Hospital in Columbia, he was like, oh, I kind of want to start like some sort of a program or something educational on our campus because we don't have that. And I was like, yeah, you're so right. And he's like, would you want to help me with that? And I said, okay, maybe, probably. And I was, let me do some research on my own, make sure this is what I want to do. And then we can kind of move forward, because I felt like if I didn't know anything, I cannot help teach people how to be a PA or how to get to PA school. So did my own research, helped get that little thing started, which was neat. Brought a lot of PAs in, got to listen to a lot of PAs talk, and just kind of furthered that like desire to do that. Then eventually applying to schools. I went to Stevens College physician assistant program, which was great. That was in Columbia. We were the first year of the program at the time, which was kind of exactly what I wanted. Like that kind of helping to get something started, like that was really fun and exciting, because I had just done that in undergrad. So I was like, oh, this will be great. I feel well prepared for this. This sounds like exactly what I want to do. So chose to go that route, and now I'm here. As far as orthopedics goes, I kind of had some top choices just based on like how I did my rotations. I had lots of different specialties that were interesting to me. Admittedly, I just didn't know as much about orthopedics. It was probably maybe 3 on my list, but I had this amazing job offer that I was like, you know what, let's see how it goes. And I love it. Like I just took a job, we can get into that, but I'm moving here shortly. And so I took another job in orthopedics. So I did not know that I was going to like it this much, but I do. And I think it's just because some patients are different, but we get a lot of athletes, a lot of people that are physically, they do physical things and get hurt doing them. And then it's fun for me to help them get back to that, because I also like doing physical things, and I would want that same thing for myself. So kind of get to relate on that standpoint with my patients. So I like it. It's good.
Well, before we get into that next step about where we're headed or where you're headed, let me ask you in regards to like your current situation, I guess, what would be the thing that's been the toughest for you to overcome through maybe your education or the job itself? What are some things, I mean, as much as you love it, what are those things that are just kind of tough right now? Yeah.
I don't think, how do I put this? So in school, we did not learn so much about how insurance would play a factor in our patients' care, and how tough that is, and how say I want to do this for my patient. I want to order an MRI. I want to order a CT scan. I want to, get them this specific brace. There is some, pushback sometimes from insurance companies. And that is the hardest thing, because one, it takes a lot of time to call in and kind of give my case for that. And I'd be the one doing it because I was the one that prescribed it. So that takes some time, especially in our urgent care. So you never know what's going to walk in the door. Sometimes we have pretty easy days that are, we only get a few patients trickle in, and then some days it's a lot. So those days where it's a lot and you need to make those calls to those insurance companies, that was a huge hurdle. So just kind of prioritizing like my time for that. Learning how I order things specifically, and making sure if this specific thing was in my exam, that goes into my note, because a lot of times, they'll ask, hey, was this positive? I'm like, oh yeah, it was. Oh, well, wait, I didn't see that in the note. Oh, well, that should be in the note. So learning that thing too was important, especially as like a new provider, even just coming out of school, that was important. So I'd say that's probably my biggest challenge to that. And of course, I mean, with anyone that starts a new job or starts a new career, just catching up to speed, trying to get fast, trying to see people effectively and get them out in a short amount of time. Super proud. I've pretty much nailed that. I can, see a patient, treat a patient, and move on to the next patient and not have this huge wait time. Anyone that comes to our group, you can even see on like our Facebook reviews, they're always so impressed by how fast we get them in and get them out and get them treated. So that's, something that took a little bit of time to make that possible. And then, sorry.
Oh, that's fine. That's the real world, right? That's the real world. Quick question in regards. You were an athlete, right? You played sports, still do, I think, right? Love to play basketball and some other things. How did some of that parlay into your awareness with health and wellness?
So I played basketball. luckily I didn't have too many injuries, which is great. Knock on wood. Like I never had anything major. But you know, of course there were like little nagging things that happened along the way, you know, like had a really bad like Achilles tendonitis, and like I didn't, you know, now knowing what it is, like I get that, but like at the time I don't know, I was just a high schooler. I had no idea. I just knew my back of my ankle kind of hurt. And so, you know, worked with someone there, and that was, I don't know, kind of just like shed light on like what those types of professionals do. So that was pretty interesting. But I think like specifically how that kind of helps me moving forward is that I can relate to like a lot of these high school athletes. I can relate to that. I can relate to people that play this sport specifically. Like if there's a basketball player, you know, I can really get that. Or just being really well informed on like, you know, maybe it's throwing. I played softball when I was really little, but really don't know much about softball. But then just in the orthopedic realm, you know, learning like mechanisms of throwing, learning that there are stages of throwing, and like learning and asking those questions, like when does your arm hurt when you throw that? You know, is it lined up? Are you accelerating or decelerating? Like what hurts? You know, so having that general like sports knowledge, I think earns that respect from a lot of patients who get hurt doing sports, because they're like, oh, this girl gets it. She knows sports. She's sporty. Oh.
Yeah. Okay, let's go into where lots of things changing for you. The landscape's going to be a little bit different moving ahead. So why don't we talk about where you're headed in the next few weeks?
Yeah, so I am moving to St. Louis. So moving to the other side of the state, from Kansas City now, moving to St. Louis. My fiance is a dentist in St. Louis, and kind of the Chesterfield town and country area, if anyone's familiar. He has been working there for a couple months now, so he's well established, ready for me to get there, and finally got a great job offer that I took, and I'll be headed there. The new place, it's kind of on more the Illinois side, and we're going to be, instead of being in an orthopedic urgent care, seeing neck to toes, I'll be just constrained to the upper extremities. So I'll be fingers all the way up to shoulder, which will be really interesting because, you know, that's one of the more common things that come in is the upper extremity. Obviously, you've kind of got two options, like upper or lower, but upper does come in a lot. So I feel pretty well prepared for that, but it will be interesting. It's different. I'm you know, in my experience now, like I'm a sole provider in my clinic. I don't have a physician that I directly report to every single day. I mean, I have a supervising physician, but if I have questions, I just choose whoever is, you know, the question would pertain to, maybe our spine surgeon or maybe our hand surgeon or whoever the case may be. So now this will be interesting. Like I'll be working directly with a physician, and I will be like his PA essentially. So what he's not doing, I'll be doing. So, and that'll be interesting. I'll get a little bit more surgical experience too, which I don't have a ton of. So I'm excited to like get in the operating room and learn about that. And, you know, yeah, obviously I had a lot of that during school, but then those last 2 years, not a lot of OR stuff. So that will be a cool change of pace, I think. I'm excited.
What's your thoughts on peripheral type care? Maybe more functional approach with chiropractic care and some other modalities of therapy. What are your thoughts with that, and how do you work together if you do with that type of approach?
Yeah, so we have a lot of patients that come in that seek care from, you know, like chiropractors are kind of probably the biggest one that we get. And you know what I always tell patients is if it helps you, it makes you feel good, I like it. I like things that help you and make you feel good. That's kind of how I see that. But we work a lot with them. Like, you know, maybe they will find something on an X-ray that they're concerned for, because if you go to a chiropractor, sometimes they'll get X-rays to take a look at your back or your neck or whatever the case may be. And a lot of times they'll, you know, if they do see something that's abnormal, they'll want to get them in to see someone like, you know, a surgeon or an orthopedics who may have to do something about this, may need a specific brace or something. So we get that sometimes. They'll essentially consult us, or they'll send that patient to us because they're concerned. Or maybe they have done chiropractics and they've, you know, we're getting better over time, but now they're getting worse. And so they have concerns on their end. So then they will send them to us to kind of see what we can do to help with this certain patient's case. So we do work with them. You know, we don't have any in our practice, but we work with them kind of on the outside.
Gotcha. Knowing that nutrition plays such an important role, especially as people age, what's your thoughts with, that's sort of where I spend a lot of my time and my preparation with a lot of my clients in regards to nutrition approaches. And we already kind of hit on the idea of inflammation. What's your advice to folks? Do you even go there? Is that something that you would spin off to somebody else, or is that something that you feel comfortable discussing with some of your clients?
Yeah, I mean, it just kind of depends on the patient, and kind of like, obviously we're in like a walk-in urgent care setting, so we kind of all rolling. A lot of times patients will see us first, and then we will get them triaged kind of to where they need to go. They'll be following up with this surgeon or this surgeon, so we don't always keep them. So it depends on what their treatment plan is. But if it's someone, that I know that we may not see again, or someone that I think would benefit from that, or the patient has time to kind of listen and kind of discuss that, or if they have questions on their own about that, then certainly we talk about that. People ask me all the time, is there like a specific diet or something like that? I mean, it really just depends on what works for you. That's kind of a hard question, but I get that sometimes people want to know from a healthcare professional what they should be doing. Maybe we'll touch on just making healthy choices. Talking about portion control is huge. That's really huge. So if we get on that, that's generally probably majority of the time, that's what we're talking about, is like portion sizing, and kind of making better decisions. Because, we'll even have patients that come into our clinic and they'll be carrying like a Burger King bag or something like that. And we'll still have that discussion like after that, but you never know. You really never know what's going to walk in the door, what their problem is, or what their question is, or whatever. But we do get that sometimes, and it just kind of really, like I said, just depends on the patient on if we touch on that, or if that's something I know will be touched on as they follow up and like extend their care.
What do you like to do for fun, Sam? I'm sure some of our listeners and viewers would like to know a little bit more about you personally. What do you like to do? I mean, it sounds your enthusiasm for your career, your job is obvious. I mean, but what do you do for fun?
I love, honestly, anything that's like active outside, like especially if it's active outside and competing with someone. That is my favorite thing to do. Like, I love that. I grew up playing basketball, like in the driveway. We played wiffle ball on the side of the house. We would go and play sometimes Foursquare. It just depends on what we wanted to play, but like every single Saturday, every single Sunday, even during the week, sometimes we'll come home and be like, let's play some basketball. Let's go do it. So I love that. Even my fiance and I, like, we'll play pickleball. That was kind of a new thing that we picked up. So it's a good thing. Like, stay active. You get to kind of count that as like part of your workout for the day, but it's also like super, super fun. So we do that. We do a lot of hiking too. So we invested in a good pair of hiking boots, and like we have this little app. It's called the All Trails app. You can download it and it'll tell you where hiking places are just around you, which is neat. And like people can review them and say, hey, like one we avoided because someone had reviewed it like a couple days before and they said it was super buggy and super like lots of flying bugs, and I hate flying bugs. So not go to that trail. But yeah, like just anything that's like outside or like working out, like I really do love doing that. Like that's kind of like my like stress outlet. I feel better when I do that. I know when I haven't like worked out or done something active that day, like I can feel it. Like I don't feel well if I don't do that. So that's what I do. I like doing that. Hanging out with family is great. I obviously have a very tight-knit family, so I'll text Sherri if like I've got a day off and I want to get lunch or something, and she's like, yeah, let's do it. So we usually find a time. Obviously pre-COVID was a little easier than that, but than it is now, but that's awesome. Yeah, I mean,
I have to interject something because you kind of slow played it here, but this is a genetic condition, but the competitive nature of our family. I know when my husband and I got married, one of the first interactions between Sam and Tyler was we had a family wiffle ball game at the park. And by family, I mean aunts, uncles, cousins, grandma. Everybody's out there playing wiffle ball. And my husband's up to bat and he makes kind of a little wimpy hit back to the pitcher, Sam, who is like, I don't care if you're new to this family or not, dude, you are out. And she,
Yeah.
impales him with a wiffle ball because we have to win at every sport.
Yes. I mean, even like, well, if we're not, if the weather's bad and we're not outside, like we'll be playing card games and those get intense. Intense. Like we're very competitive. I think my dad always says he'll get like, he has like in his job, like he'll interview people and, he'll ask you, he'll be like, what do you think about the phrase? Like, it's not about if you win or lose, it's how you play the game. How do you feel about that? And obviously most people are like, yes, it is all about that. Like we like playing together, like something stupid. And he's like, nope, you're wrong. It's winning. Winning's the only reason you
I love it. And it's kind of funny, Sam, you probably don't know this, but your aunt and I kind of joke around that we have a lot of those things in common too. And certainly being that competitive, being a coach and an athlete myself too, it was like, yeah, I just think winning is kind of important most of the time. I have to really play that down sometimes. And because I know that it's not politically correct in certain places, restaurants and movie theaters, it's probably not good to be competitive and find things to jump in front of people in lines or whatever it might be. So I have to kind of moderate that a little bit in my own mind. But I got to ask you guys this. You guys obviously know each other very well. What's something that our viewers may not know about Sherri? And Sherri, you get your turn too. Tell us something about Sherri that most people probably wouldn't know.
Hang on, I did not approve this. So,
you get to do the same.
Man, gosh, there are like so many things. I got to decide which one's the best one to tell. Oh man, I've got two. If that can I do two?
Absolutely. Yeah. I love it. There's the competition model right there.
Yeah. Now my mind, I'm going, okay, I better get a second one.
So, okay, one thing that people didn't know, and honestly, well, I would say the people that we were with didn't know, but one time I really wanted to get my ears pierced. I wanted to get my ears pierced, and Sherri went with me and signed like my mom to do that at the time, because not only am I very competitive, but I'm very much a rule follower. So like that had me
That's awesome.
Good. But we also kind of shared a parenting of a dog. Her name was Ruby. She was the best in the world, the best dog in the world. She's a black pug. My parents got her, and I was younger. I was like, I guess I would be about, how old is Tyler? I was about 6 or 7, and Tyler was like 1, 2, 3-ish. Was my brother, and my parents came home with this tiny little pug named Ruby. Oh my God, she was the best. And then my brother started to have really bad allergies to Ruby, and we needed to find a home for her. But I couldn't even imagine getting rid of Ruby. Like I was beside myself that Ruby needed to find a new home, because Ruby was like my dog in my thoughts. So luckily my Aunt Sherri kind of stepped in and made everything better. She said, I will take Ruby, and Ruby's your dog, but she's gonna live at my house now. And I was like, that makes a lot of sense. Let's do that. I like that plan. And so she took on Ruby, and Ruby lived a great life. And every time, that was so special, like going over to her house, got to, be with Sherri, but also got to be with Ruby. And it was just like the best.
That's hard.
Yeah.
You didn't even throw her under the bus at all. That was really.
I know, man. I mean, I don't know. I'd say Sherri has like the best sense of humor and sense of humor. Like bath humor are Sherri's forte. That she finds it hilarious. My fiance does not find it funny. He does not like bathroom humor. He doesn't like that. He does not think poop jokes, whatever, are funny. And I think they're hilarious, probably because of Sherri. when we're at each other, Michael's like, that is where you get your disgusting humor.
Yeah, I've picked up on that a little bit over time too. All right, Sherri, what's one thing that most folks don't know about Sam that you could share?
Well, I'll try to be nice also, but
She's saying she has to try to be nice, by the way. Right?
Man.
I will say that Sam she's really set up for a second career. So from a very tender age, she could definitely impersonate Shania Twain, and she can sing I Mean Any Man of Mine.
Oh my gosh. We may have to have her back on the show later and have her sing for us.
I think so.
It was when I was like 2, but 3. It's become less cute over time.
It's pretty darn good.
I think I'm like Shania. I think I had like a vocal cord issue. I think that's
it. But Sam is the first niece, and because of the way, there's 6 kids in my family, and her brother or her dad is my brother. And so because of that, our age difference is such that it was just the perfect relationship of aunt niece. And so I could be like the cool aunt, I didn't have to be like an adult where I have to follow any rules. So yes, I definitely signed for her to get a piercing. I'm so thankful she didn't want a tattoo, because I probably would have gone for it.
Oh my gosh.
So we have a very special relationship, and I could just tell you all kinds of funny things about Sam, but I'll just be, I'll just say, hands down, one of the coolest people.
That's pretty cool. That's special. Sam, is any other things that you'd like to dig into before we call it a day? Because I will say this, maybe sometime down the road, after you get settled into your new position, we could have you back on and kind of give us an update of what's new and how things are going in your career. And I'm sure people will love to see you back on. You're pretty entertaining. I mean, in a very good way. In a very good way.
I like that. I don't know. I know Sherri reached out whenever I had just done a really cool challenge, like kind of back to when I being super competitive, had to finish this. But if people are looking for a really cool workout kind of mental toughness challenge, I just did this thing called 75 Hard. It was 75 days. You have to drink a gallon of water. You have to work out twice a day. One is supposed to be outside. Maintain a diet, or maintain some sort of something with a diet. It doesn't have to be anything specific, but some kind of diet, including no cheat meals, no alcohol, no kind of bad foods, anything if you had to second guess it, probably can't eat it. Read 10 pages of a nonfiction book every day, and take a selfie kind of progress picture every single day. And I had just finished it about, I guess it was a week ago, maybe a little more than a week ago, and it was awesome. So if anyone is looking for that, if you just Google 75 Hard, it's awesome. I mean, it's definitely hard. It's not easy.
What was the toughest part about that, by the way, Sam?
I don't know. I'd say as healthy as I am, I love beer. And so I miss that. But the hardest thing, so to fit in 2 workouts, I need to get up in the morning and work out before work. And when I work these long 12-hour shifts, it's so hard to get motivated to get up in the morning. But every time you do it, it's so worth it. And I have to remember the last time I did it, that it was so worth it. And I felt so good in the morning after doing it. But every time in the morning, my alarm goes off and I'm like, nope. I don't want to do that. I don't want to get up. I don't want to do that. Was so hard to get out of bed to do that. I'm like, I could just sleep 1 more hour and then just get up and go to work. or I could get up now, get my workout done, and not stress myself out after work to get that done. So that was pretty hard for me. My fiance did it too, and he's a morning person, so he would get up and work out, and it was no complaints. But for me, I was like, oh, I don't want to get up.
So I don't know if you guys can see this or not, and I was going to try to share my screen, but I'm challenged. So I'm going to just show you if you can see it on my phone. But this is Sam's before and after selfies, and she looked pretty darn great in the first picture. But I would just say too, as a comment to that 75 Hard program, I felt kind of challenged myself to maybe give that a try. But one thing I think that we forget about in wellness and health is the mental aspect of it. And whether it's from a, spiritual, mental health, financial health, those are all aspects of health and wellness too. And so that was one of the cool things I felt like about what you told me about 75 Hard is, yes, we hope to have the most in tune, in shape type bodies, but if we don't have it going on up here too, it makes it really tough to do the rest of it. And it's equally important to be to have good health mentally speaking as well.
Yeah, I agree.
That's fantastic. Yeah, good information. Do you think that you'll be able to take some of those components more into a daily routine now that you incorporated them for 75 days?
Absolutely. Michael and I have made it a point to kind of make healthier food choices. I think it'll be easier too when we're together, like when we were doing kind of long distance stuff, like we would get together, and every time we were together, it's a party. We go and we have food, we drink, we eat, we do whatever, because I'm not going to see him for a week after this. So it's going to be a little easier when we're together and have kind of like a more of a routine thing. But making healthier choices is something that we've already adapted. That it doesn't even sound good sometimes to eat some of the stuff we used to eat, and when I do, I just feel terrible. So making healthier food choices for sure. Working out every day is a must. Like I said, I know, after this was over, I took a couple days to just kind of rest and not work out at all. And I was like, I can't get back to it fast enough. I don't feel well not doing something like that. And then the reading thing, I've never been a really avid reader. I think it's maybe just about I haven't found books that I was excited about. But through this, they want you to do a nonfiction book. So just using that to learn, to kind of just I don't know, inspire me. Some of these books, they really did. They just lit a fire under me. I was reading those and doing the challenge at the same time, just made me excited, made me really motivated to do all the things that I want to do. So the reading thing, we're going to make that a point, and we've already, we've kept going on that. So
I absolutely love it. I think that, Sherri, you sort of touched on it too, but is adding all of those elements into our plan and our protocol is so important. And just engaging, taking, and maybe it is only reading 5 or 10 pages a day, but to start that initiative and, developing that habit, that's just part of who you are. That's part of your DNA. Is so important. So, Sherri, why don't you do something and kind of take us to the close and tell us anything that's happening in regards to the CWC in the programming or anything else, and then we'll kind of call it a close for today.
We just continue to build on our wellness services, and certainly when you think of a clinic, you always think about treatment and maybe illness or injury. And certainly we continue to provide those services in the best COVID safe way that we possibly can, which right now is that we just ask that you call ahead so that we can make sure that we are using our space wisely and distancing and so on, and we can be prepared for you to come visit us. But I really would encourage everybody to check out, we have a new website that we started a few months back, and I know you're going to find this hard to believe, but it's consigliowellnesscenter.com, so pretty much our name. But check that out for our other wellness services. I mean, and certainly you'll probably hit this too, Mike, but our fitness classes that we have going on at the Aquatic Center, other classes that we're offering to help educate people on the ideas of wellness. And you know, all of our services are listed on there, but we certainly want to offer to our member districts the best holistic care that we possibly can. And so so in effort to do so, we've really grown our wellness program and services. So I think there's probably something for everybody, so check that out.
Yeah, definitely. I would encourage people to check out our website, and certainly look on Facebook. We have a Facebook page as well as a Facebook group. So if you're interested and you'd like to join our group, certainly apply for that. We'd love to have you guys join in on it. We try to provide some updated information about what's going on in the wellness side of things, along with the clinical side at the CWC. So a lot of information is made available. And Sam, for you, it was such a treat to get to see you and meet you on, even though it is virtual. Hopefully someday we'll get a chance to cross paths, and we'd love to have you back on the show sometime soon.
I appreciate it. It's been fun.
Al, if we'll call it a day, so we look forward to it, and hopefully we'll see some people at the presentation. By the way, I forgot to mention that tonight at the if anybody wants to join us, we have a Ditch the Diet presentation at the wellness, or I'm sorry, not the wellness center, but the aquatic center, Blue Spring South Aquatic Center at 7 o'clock tonight. That would be Wednesday. So if you would like to join us, this is the second of a 3-part series, so we'd love to have you come by and join us for that. But if there's nothing else, then I'll sign off for both Sam and Sherri. You guys have a great day, and we'll be talking soon.